Good morning, everyone, and welcome to BusinessWorld Insights. I'm Janina Ibanez, and I'll be moderating our session on ensuring a COVID-19 protected environment. As the government's vaccination program ramps up in earnest, many are hoping that it will finally bring an end to the pandemic that has overwhelmed the country for almost 2 years. The question that remains is, will it be enough? The news of the COVID Delta variant making its way onto Philippine shores has thrown a wrench into the slow process of the country's recovery, and leaders, policymakers, and businesses must contend with this new threat to keep it from getting out of hand. Ensuring the end of the pandemic means navigating through these emerging issues while keeping public health and safety as a top priority. We have excellent speakers with us today from the private and healthcare sectors, and each of them will have some opening remarks. Let's get started. So our first speaker, Mr. Edgardo Lacson, is the acting president of the Philippine Chamber of Commerce and Industry. He is also a director on the boards of the Philippine Stock Exchange, Pure Gold Price Club, Global Ferronickel, and De La Salle University. Mr. Lacson also serves as the chairman of the Employers Confederation of the Philippines, a member of the Management Association of the Philippines, a trustee of the Philippine Inter-Island Shipping Association, and a past president of the Philippine Petroleum Transport Association, the past president of the PCCI, the past director of the PSE Securities and Clearing Corporation, and the past trustee of the Pag-ibig Fund. He was also a managing director of the Link Edge Management Corporation, a member of the Philippine Nippon Kyokai Technical Committee, director of Zest Tower, and a trustee of the Philippine Disaster Resilience Foundation and the Strat-Based Institute. Mr. Lacson?
Good morning. Good morning, Secretary Joey Concepcion. I think he's around. To my fellow panelists and all the viewers of this program. COVID-19 is man's worst nightmare in this 22nd century, our century. After several pandemics in the past, killed almost a quarter of the Earth's population. Before globalization, countries were fragmentally spared the economic downfall from the past pandemics. But today, with all nations globally linked by an interdependent supply chain and increased mobility, the explosive spread of COVID-19 is seriously impacted all countries with emerging economies like the Philippines, sustaining far greater damage in life and livelihood than first world nations. COVID-proofing our economy looms as a seemingly insurmountable challenge for both the public and private sectors as we endure the harsh and seemingly endless protracted lockdown. But when the poet Alexander Pope said, "Hope springs eternal in the human breast," he must have Filipinos in mind when he wrote this. Let me walk you through history to show the resiliency and persistence of our people as we survive all natural and man-made calamities. The Filipinos endured untold sufferings from the colonial days of 350 years under Spain, 50 years under America, 5 years under Japan, 12 years under martial rule, currency crisis of 1997, global subprime crisis of 2008, volcanic eruptions, earthquakes, and 20 yearly typhoons. We survived all this and forged our destiny as a nation. As one German philosopher said, that which does not kill you will make you stronger. Today, COVID-19 is the single greatest and deadliest threat to health and economy in our country and the entire world. The second is the threat of lockdown, which is more fearsome than COVID infection itself for employers, workers, and ordinary citizens. Inarguably, protecting human life is paramount. Quality of life is equally important, unless we are prepared to live backward in time and live without dignity, without honor, without jobs, and subsist in a hunt and gather society. The Bible teaches us that by the sweat of our brow shall we eat. This implies that joblessness and poverty is dehumanizing if one is forced to borrow, beg, or wait for ayuda. Together as one people driven by hope, we will rise from the edge of the economic black hole where COVID-19 has pushed us. Today, we face an unseen enemy in COVID-19, a pharmaceutical problem which we are trying to solve once more by applying again the military solutions of lockdown. And that will end my speech. And I'm open for the open forum. Thank you.
All right. Thank you so much for that, sir. So for our next speaker, we have Dr. Annalisa Onglim. Annalisa Onglim is a professor, attending pediatrician, and chief of the Division of Infectious and Tropical Disease at the University of the Philippines and the Philippine General Hospital. She is a fellow of the Philippine Pediatric Society, where she serves as a member of its board of trustees. She is also the immediate past president of the Pediatric Infectious Disease Society of the Philippines, and as part of the Philippines COVID-19 response effort, Dr. Ong Lim currently serves as a member of the DOH Technical Advisory Group, the IATF Technical Working Group on COVID-19 variants, as well as the Interim National Immunization Technical Advisory Group for COVID-19 vaccine. Dr. Lim?
Thank you, Janina, and good morning to our viewers. Thank you for the opportunity to join this distinguished panel and have an opportunity to discuss ensuring this topic of ensuring a COVID-19 protected environment. I'm a healthcare worker who happens to be, who has been drafted into the public health response. And as such, I actually wear a lot of hats, but all of them converge with the same concern, which is trying to address COVID-19 transmission because this is recognized to be um, the main way by which we will be able to really control the current surge and allow for both life and livelihood to go back to normal and even move further or move forward to a better future. So, the strategies that the healthcare sector has put into place continue to be effective for the classic or the wild type COVID-19 virus and retain their efficacy even for the current variants. And I hope through this forum we'll be able to educate our listeners better, maybe explore some innovative ways by which we can continue to push the um, different strategies forward so that people are better able to implement them and comply with these recommendations. Thank you.
Thank you so much, ma'am. Our next speaker is Mr. Joey Concepcion. He is currently the Presidential Advisor for Entrepreneurship. Mr. Concepcion is also the founder of the Philippine Center for Entrepreneurship, Go Negosyo, a movement that aims to alleviate poverty by empowering entrepreneurs and eventually transform the country into an enterprising nation. In the advent of the COVID-19 pandemic, Mr. Concepcion led the Philippine business sector in conceiving Project ARC, whose mission is to make mass testing available and affordable in the workplace and in communities to save jobs, lives, and livelihoods. Mr. Concepcion? Are you able to turn on your camera, sir?
Good morning. Uh,
There we are.
am I clear? Am I clear?
Yes, sir.
Okay, thank you. Good morning. Uh, I just came from a meeting with the transport group together with Secretary Tugate, and let me explain what we're trying to do. Some organizations are misunderstanding our initiatives in what we are trying to do in balancing lives and livelihoods. Been basically at this for over a year and 6 months since the very start of the pandemic. And for the business sector, lockdowns are something that we don't want to do because we affect our own business. But there comes a point in time that certain things change and we have to adopt. The roadmap that we are trying to pursue is something that is sustainable, whereby lockdowns will eventually be stopped if we're able to do certain things that will prevent lockdowns from happening. So Basically, this is our roadmap towards the next normal. Um, Next slide, please. This is the timeline. Talking with Chairman Avalos and members of the IETF, if you population protection as defined by Okta is basically at 50%, no? And that means 50% of our population in NCR must be vaccinated. Uh, with the advent of Delta, this percentage has to move higher. It's at 60%. The goal is to try to hit this between the months of September and October. Some of the LGUs are close to making this happen. The next goal is to try to achieve herd immunity uh, by November, December for NCR. We're not talking of the entire country. No, we're talking of Metro Manila, the National Capital Region, and MMDA Chairman Benhar Avalos is the lead here, together with the 16 mayors. So the focus is to try to achieve herd immunity. Initially, it was at 70%. Now, many of the medical advisors are saying this has to move higher, 80% or even higher. And the goal is to achieve that before the end of the year. And it's possible because we have AstraZeneca vaccines arriving already, as we see, and Moderna as well. And the orders of Secretary Galvez with Pfizer and the rest are all starting to come in. Next slide, please. The objective of the private sector is to really make sure that the last quarter of this year remains lockdown free. We can't afford a lockdown on the biggest quarter. As an entrepreneur, most or all of businesses uh, do extremely well, and this last quarter will be extra special. Aside from it being a Christmas period where you have Christmas spending moving up, the differentiator in that quarter will be election. Election spending will start to happen, uh, and that will add to that, no, as well. The consumer spending will further increase because of election spending. So, and also what we want to do is as the, we cross over to the year 2022, we don't want to break the hearts and the hope of all our MSMEs who have struggled since the beginning of the year, especially with the earlier lockdown this year. And the second lockdown now, which is 2 weeks. If it remains 2 weeks, then great. If it's extended, then of course they will suffer a bit more. No? But then again, what's important is, do we lock down early or do we lock down at the end of the year? So hopefully, with all the initiatives done by the private sector, LGUs in this lockdown, by vaccinating our employees at a rapid pace, and the LGUs hitting at 650,000 a day, and with the vaccines arriving, these timelines that we stated in the calendar, which I presented earlier, will be attained. So what we're trying to do is this lockdown creates basically a wall of defense. No? It allows us time to reach the unvaccinated first. So it is a race between who gets to the unvaccinated first. Is it the private sector and LGU vaccine, or is it Delta that will get to the unvaccinated? We don't want to create and make this the pandemic of the unvaccinated. And that is where it's headed towards to. And that's why we designed a structure where we will hopefully prevent this under this structure. So the objective is definitely avoid at all costs a lockdown in the fourth quarter. Next slide, please. What you need to do is to create micro herd immunity. We don't need to wait for micro herd immunity towards October, November. We can do it now, and that's being done now. As the LGUs vaccinate more people in their respective areas, as us in the private sector with our vaccines, we not only give the employee the vaccine, but we also allot for his family. And those companies that can afford the kasambahays, they will be allotted as well. No, we also want to fully vaccinate all our employees in the office buildings and of course in the factories, and that's happening right now. We have close to over 50 shared vaccination centers that Go has created with SM, BDO, Philinvest, etc., all over, because many of those that ordered are also small businesses, no, who order 20 doses, 50 doses, 100 doses. So we have to look for them sites to be able to implement this. So that is happening as we speak. The LGU is also doing the same thing. And we want to ensure that the moment this happens, we are able to transport those at home to the workplace safely. And that's why earlier I just finished my meeting with the entire transport group and Secretary Tugade, and he's committed to provide fully buses and other transportation for fully vaccinated and also for the unvaccinated people. They will try to segregate, and they will need about 40,000 doses vaccines to be able to inoculate the drivers and the conductors. So we will try to search for this quantity for them. Uh, and hopefully we are now able to complete that bubble, no? Fully vaccinated at home, transporting to the workplace and back. So you create that bubble. That's basically your defense. Next slide, please. Moving forward, we want to adopt, and of course, this will have to go through IATF. I've talked to Sec Maynard, I've talked to many of the different secretaries. They're all open to the idea provided we get the vaccines. So how do we activate the economy? You can't allow the unvaccinated to go out. That's like, you know, telling these guys, you know, you're going to be infected and you'll be hospitalized. 85%, you can call the hospitals and ask them, 85% of all going to the hospitals are unvaccinated. Okay, I checked with Makati Med, I checked with San Lazaro, you see the PGH. That is the area that we don't and want to protect. We want to protect the unvaccinated. It is not a discriminatory. We have a health issue. We have Delta. Delta is so infectious. I have friends that we were supposed to meet the other day. If I didn't text them, I would have got. We didn't test them, we would have gotten infected because they were infected with no symptoms and they are fully vaccinated. So Delta is able to penetrate those that are even vaccinated, whether Pfizer, Moderna, these people had it. But the difference is they are asymptomatic. It's just like a common flu, and they get well in 3 or 4 days. So, in other words, the vaccinated are adequately protected from getting severe or even dying. And that's true. You can see that in the data that's presented even by FDA Domingo. So, vaccinated are the people that you can have to get the economy moving, but allowing only vaccinated to enter certain establishments like malls, restaurants, spas, salons, etc. This can be defined what establishments will IATF allow. No? And this is the way to open the economy, not allowing unvaccinated to enter these places because they will just get sick. They will be the ones to cause the capacities of the hospitals to go at maximum level. And of course, many of them can even die. So under Delta, the game has changed. No? Granular lockdowns will not work under Delta because Delta is so transmissible. No? So we have to prevent lockdowns in general by doing something like this and creating an enlarged bubble whereby people from home can go to their workspace to a transport that is secure for them from getting infected. They can go to the salons, spas, malls, and restaurants, and they'll be secured because it's only the vaccinated that will be allowed to enter these establishments. We can create more activity because more people will have confidence because they will know that it's only vaccinated people that can go out. Discriminatory? No, it's not because this is a health situation. The unvaccinated, until they get their vaccine, will be allowed. Now, is this going to be done tomorrow? No. Our target is to look at it sometime September, October, when bulk of the vaccines start to arrive actually now all the way till the end of the year. And that's going to be a lot, maybe 5-10 million a month, according to Secretary Galvez. And we will have more from the private sector. So in a nutshell, this is what I've been focusing at and trying to look at a real solution that will allow us to operate under this bubble. Thank you.
Much for that, sir. For our final speaker today, we have Dr. Sally Gaspar. She's a medical director of Aventus Medical Care, a multi specialty outpatient medical clinic of the IntelliCare Group, and a healthcare service provider for the COVID vaccination of the private sector. Dr. Gaspar has completed her Doctor of Medicine at Fatima College of Medicine, took her Bachelor of Science major in biology at the University of Santo Tomas. Prior to joining Aventus, she gained 20 years of leadership experience in the healthcare and post-acute care services industry in the United States, while completing her Master in Public Administration with healthcare emphasis in DeVry University. Dr. Gaspar.
Thank you, Janina, for the introduction. I would like to thank Business World for inviting us to join in this webinar to represent the sector that delivers the medical services to patients in the private sector. Good morning, everyone. As a health service provider, one of the many tasks that we have is to ensure a COVID-19 protected health environment in work and in home. Next slide, please. First, next slide. Louis, next slide, please. Thank you. There you go. Thank you. First, we take care of our employees who are our frontliners in healthcare delivery. We have initiated daily health monitoring tracker online that screens, identifies, and manages their symptoms medically. The regular COVID screening tests like the rapid antigen and RT-PCR are readily made available to be done on an as-needed basis or on a routine schedule, especially with our medical team in the clinics who sees patients. We created a bubble between our offices and clinics and their homes. We provided quarantine shelter during the peak of ECQ and provided shuttle service for the employee. The employee COVID-19 vaccination program is actually an important aspect of our commitment in providing protection for our employees from the severe COVID illness. Now, the work from home, reduced manpower, and shifting schedule has helped us to provide our services innovatively without affecting the care to our patients. Now, in line with this, digitizing most of our processes has made the workflow more efficient and effective. Now, we are in a pursuit of getting 100% of our employees and their dependents COVID vaccinated. Next slide, please. We care about our patients and customers in making sure the minimum health standard protocol is observed. The appointment setting model has ensured controlled census to observe social distancing in our clinics. There is a triage staff that screens patients, which helps us identify who goes to the isolation consultation area versus the regular consultation room. The medical team in our clinics wears a complete PPE as part of our infection prevention measure. As a COVID-19 impacts some of our patients' ability to come to our clinics physically, we have our teleconsult platform called Aventus MD, which is a recognized telemedicine partner of the Department of Health. This has helped significantly to increase our reach to provide medical service advice at a distance between the patient and the physician. Now, the home health and home care program is another alternative approach in bringing the healthcare services by medical personnel to patients in their homes. The COVID-19 screening tests, such as the rapid antigen and RT-PCR, are available for patients to avail in our clinics and in their homes via home health. Next slide, please. We care about our partners and suppliers. We recognize that our physicians are our key partners, and we are heavily engaged and dedicated in making sure that those who are unable to be on site in the clinic can have the opportunity to practice medicine in Televentus MD, your clinic in the cloud. We have also kept our clinics and diagnostic centers open for HMOs, insurance companies, corporates, and private paying patients. Since we continue to provide health services, our suppliers continue to provide supplies and equipment. By caring for our employees, patients, customers, partners, and suppliers, we maintain a stronger forefront in providing healthcare delivery in work, in home, to you. Thank you.
All right, thank you so much. We will now proceed to the question and answer portion. We will also ask a few questions from our viewers. So, to our audience today, please do send in your comments or your questions in the comments section. So, for our first question, um, vaccination is ramping up in the Philippines, but for now, there's just around 10% of Filipinos who are fully immunized against COVID-19. So, to our speakers today, what is your assessment of the efficiency of the government vaccination program, and what do you think can be improved? Um, Mr. Laksa, maybe you'd like to share.
What was the question?
What's your assessment of the vaccination program so far, and what do you think can be improved?
We keep on I'm saying that COVID-19 is a pharmaceutical problem, and yet lockdown is a military solution. And I have read a lot of medical journals saying that simple masking can prevent transmission of the COVID-19 or its variant. Simple masking, and we even have face shield, social distancing, hand washing. All this, in the absence of vaccine of the herd immunity, can still prevent the spread of the vaccine of the COVID-19. And we don't even have to resort to the harsh lockdown because we have tried it 3 times. This is the third time that we are imposing a lockdown. And the first two, the spread of the virus continues. So maybe we have to rethink and balance our strategy. If COVID-19, if we are at war with COVID-19, and this is war, locking down people is not a tactical retreat as a strategy. It's a total surrender. And the damage in the economy is going to be felt many, many generations from now. Thank you.
Right. Mr. Concepcion, would you agree with that?
Well, no, definitely. I mean, we don't want lockdowns. No, I mean, who wants lockdowns that affects our business? But at certain times, no, lockdowns are necessary, as you see in even other countries, Australia, Europe, India. I mean, Indonesia, Malaysia. I can name. Delta is different, no, and sometimes you're forced to lock down. What lockdown? Lockdown doesn't get rid of the virus. It will never do. What lockdown gives us is an advantage to reach the unvaccinated first with our vaccines. No, the moment we are able to hit herd immunity, which is about 80%, no, hopefully hit herd immunity and eventually 100%, then that wall of defense becomes more fortified. And we don't, the reason why we're resorting into and proposing unvaccinated are the only ones allowed to go in certain establishments is because you don't want the hospitals uh, to hit capacity with the unvaccinated getting to the hospital. So yes, it just gives us time. And is the 2 weeks enough? Hopefully, it turns out well, and that's why our group called it much earlier because we wanted to ensure that the last quarter will not be affected, which is the more important quarter. No, so in other words, it's very hard to say who is right and who is wrong. No, at this point in time, nobody has really experienced this kind of pandemic. So the entire effort from the private sector is to, think of ideas uh, that we can do, no, to allow the economy to be lockdown free. And what we're proposing by creating a bubble may do it. No? And if we get the support from Secretary Tugade and of course IPF, especially to allow only vaccinated to go out in these establishments, then I think this might be the end of lockdowns. No?
Right. To follow up on that, so you said that you're hoping for herd immunity by around December, 70 to 80% of the population, or the NCR plus population.
NCR.
Yes,
NCR, not plus. I said NCR only.
NCR population. So, are you? What do you think is needed to make that possible, and are you hitting any snags when it comes to that?
Well, with regards to the private sector, it's very easy for us because we just command employees, okay, this is the day, everybody has to go, etc. So private sector is able to execute in that manner. With regards to the LGU, I'm very happy to see that many of our mayors are really so aggressive and passionate to really see that they are able to open up their own economy in the respective LGUs. And the only way forward is really to vaccinate their people. Imagine, let's say Makati is 80% vaccinated already. So you feel more protected going out even if you get sick, you won't go to the hospital, so we won't have that problem. So we now can leave the economy open. So what the private sector has to do is, okay, it's not enough that we say we don't want lockdowns. We don't want lockdowns, but this is what we're going to do. That's the more important thing. What are we going to do? So these are the things that we are going to do to prevent lockdowns from happening. And we have to work with the the mayors of Metro Manila, because this is where bulk of businesses are, and this is where a great percentage of the GDP comes from. And of course, we want to make sure that the first engagement in this battle, we win. No? We have to win the battle against COVID-19 in NCR. And there's no way to lose, because if we win that and we prove that this formula does work, when you hit 70, 80%, that you are able to open the economy. Of course, still wearing masks. No, let's not commit the mistake that America did and some other countries. When they hit that threshold, then they started to party, and then it's coming back. Even Israel, you can see it; it's coming back again now because they started to open up and really party. So now they're back. They're back to lockdown. So a country like Israel and America, they're starting to lock down. So lockdown is important when you're trying to hold back the virus from spreading. You hold it back, and then you start to vaccinate. In our case, we're only at that level of vaccinating our people and targeting 70%. The other countries have achieved that. The UK is the best model. You can see that once they hit that 70, 80%, and they open up the economy safely, then there is no more resurgence. So they're able to thrive with the virus. So UK should be the model.
Right. So I want to ask our healthcare representatives. So we have a lot of recommendations from the private sector, or government when it comes to the lockdown. Recommendations surrounding bubbles, granular lockdowns, or even, as Mr. Consumption noted, areas where the vaccinated can have bubbles. So are those measures enough? And what do you think will be needed to keep the public safe? Maybe you can start with Dr. Lim.
Well, Janina, the bubbles are, of course, helpful in making sure that we reduce contact with people who may be infected. But we know that it's not totally protective. And so we continue to advise people that maybe one mindset that we can keep in mind or keep aware of is to consider every person that they meet as possibly infected. And if that's the case, then they will continue to be vigilant when they face different people, and they make sure that they are always wearing their PPEs properly, being conscious about the ventilation as well as the times of interaction. I think this is particularly important in the work setting where many different interactions happen on a daily basis. And even if we're able to ensure that many of the employees in a particular setting are already vaccinated, the fact that they continue to go home to their households exposes them to different people. So I think one way, no, to manage this risk is to educate people. Keep in mind, anybody that you face can be infected, and use that mindset as a way to strategize about how to protect yourself from being infected as well.
All right, thank you, ma'am. Can I ask for Dr. Gaspar's thoughts as well?
Yes, Janina. Well, to add to what Dr. Anna mentioned, I think we all have to remember that this is actually a shared responsibility among government, private sector, and us. I think the bubble, the minimum health standard protocol is our way on our own to do what we can. The vaccination, it's something that will protect us from the severe COVID illness, but the minimum health standard protocol will augment what we could possibly do as an individual person and to contribute to ensure that we do not contribute further in the spread of the virus. That's it. Thank you.
All right. I want to go back to Mr. Mr. Lacson and what he thinks about what the private sector will do to ensure that their employees will be able to be inoculated. So aside from these procurements, how do you think that the private sector can encourage their employees to get vaccinated?
Actually, the business sector is all are wanting to mandate the vaccination of all employees. But however, DOLE issued an advisory saying we cannot discriminate against those who are not vaccinated or those who refuse to be vaccinated. And I think that is important for DOLE to recognize that we have that authority. That is a management prerogative to discipline employees to get vaccinated. You know, one of the biggest sin of workers in the workplace is disobedience because when you disobey legitimate management order, in San Francisco recently, San Francisco state find all its frontliners, the policemen who refused to be vaccinated. These people who were terminated went to court, but they lost. The court said this is a management prerogative. We want to protect not only other people, we want to protect people from themselves. That's why we want to be very, very flexible in imposing the vaccination. And also, I'd like to take this opportunity to thank Secretary Joey Concepcion, who is our champion and our interface between government and business. And I would like to appeal to Secretary Concepcion that maybe in the journals that medical journals that I have read, lockdown is not the only option. As a matter of fact, some even say it is the bad option. I think masking and social distancing, hand washing can also prevent the vaccination. Of course, is not
Sure, I think your audio is out. You're muted, sir. All right, maybe we can go back to Mr. Lacson later. So, Mr. Concepcion, would you agree with him in terms of requiring employees to get vaccinated?
Well, if I had my wish, yes, I agree with him because this is a different situation. We are in a pandemic. We have a variant that is more challenging than the previous variants, and we can see it. And we want to save the economy. And so, how do we do that? We need the cooperation of every citizen out there. That is their duty now. But fortunately, most companies are able to persuade their employees to take the vaccines. Initially, when we started this thing, it was in the low 40s, 50s. But like in our company, 100% from the office workers to the production people have taken the vaccine. Of course, I mean, private sector has their own ways of persuading their employees. No? The inconvenience, especially when you pinpoint that there will be less mobility eventually for unvaccinated. I mean, I believe in less mobility for these guys because they can be really hit bad if they vaccinated can also get hit, but it will not be as bad. And we've seen it that the vaccinated will have protection regardless of whatever vaccine. So yes, I hope that Sec Bello, and I've talked to him about it, and he said the moment there are more vaccines, then they can maybe push more. But I'm confident that whether that is there, I think we will be able to persuade them.
Yeah. Would you say that that would be important or required only for customer-facing jobs, or is this across the board?
I think it's required. I mean, if you really want to achieve herd immunity and have the Philippines, to be a safe country to go to, everybody has to be vaccinated. Uh, we had flu vaccines. Okay, that's optional. Some want it, some, but this one is different. No? This is a health hazard that is causing the economy to go down. You know, the amount of money that the government is spending to buy vaccines, and this is not going to be a one-off. This is going to be an annual thing. You'll have boosters, you'll have vaccines, How many billions is that? On top of testing and all of that, the amount of money required here. Now, if the economy is closed, how do you raise the money to pay for all of this? We're going to go bankrupt. So there must be economic activity. Now, how do you create economic activity in this kind of a situation? Okay, you do it with the vaccinated. Don't do it with the unvaccinated because that is crazy. Do it only with the vaccinated. It's not discriminatory because you are trying to save the economy. You're trying to save lives. So you have to have a leeway. And now at least we have the vaccines that work. At least 100% it will work from you getting severe and not really 100%, but close to a high number like 90, 95% getting dying or getting severely ill. No? So that is the roadmap. And I think we just have to get it done. It's happening. I mean, rather than all talk, let's get it going. I hope IATF will look at ideas such what we are proposing because it's not a question of, this is my right. No, this is what we have to do to save the country, especially our economy. And if we don't have the money, how are we going to pay for all of these vaccines?
Right. So the US CDC has talked about how when people are vaccinated, they are less likely to get COVID and they are less likely to transmit, but it is still possible. So if we have these bubbles where people are able to move freely, we could still potentially have, or they could still potentially transmit this disease. So I want to
Yes.
talk to Dr. Gaspar as well about what she thinks about this.
We have to remember that the virus is primarily spread through respiratory droplets when, of course, an infected person speaks, coughs, or sneezes. It could also be transferred through fomites that would enter the mouth, eyes, or nose or of people. Now, the bubble itself, it's protecting people who are vaccinated as they move from one part to another part. The vaccination's aim is to prevent the severe illness of COVID. Now, if the question is, does it guarantee if you're completely vaccinated that you will not get COVID-19? There's no guarantee. That's why there are minimum health standard protocols that needs to be practiced by us, by each and every Filipino, to make sure that we are able to do our part. Now, as mentioned previously by Mr. Lacson regarding the lockdowns, I'd like to comment on that I am not fond of lockdowns, but sometimes government in collaboration with the private sector have to make hard decisions as they look at it in a more nationwide. Um, the reason being, it's not because lockdown cures COVID. It somehow stops the spread, not totally, but at least it helps. So we need all the help we can get in making sure that we do our role as important providers, partners of the government. Thank you.
All right. Thank you so much for that. Mr. Concepcion, I think you were about to say something.
No, I'm fine.
All right. I want to ask you as well about your talks with the Department of Transportation. Can you tell us more about more details about that and what you're seeing in terms of rolling out vaccines in the transportation sector?
Well, Secretary Tugade is asking for help to be able to inoculate their drivers and their conductors in the buses and other transport. So we will do our best to help him. And he agrees in providing that bridge, no? From home to workplace, from home to other areas. If they agree on malls being for vaccinated, he definitely agrees on that concept of the bubble. And I think this is the effort that we are trying to put together. And from there, let's see. No, I mean, the timeline for this to happen is hopefully by and somewhere in September, October. This will not be implemented right away, and it will be only in NCR that we're trying to get this thing going. Hopefully, ITF would approve it, and then we can see what will happen.
Where are the vaccines going to be from, sir?
No, I will. No, we will. I will talk to Sec Galvez and ask him. We have donations that we gave the government, but they're arriving still on February next year, 3 million doses. So Galvez has allowed us to get it back and donate it to LGUs that we would like. But the only problem that these donations will arrive we back-ended the donation so that the private sector can get all their doses first, no? So I will try to see also from the private sector if they have any doses still to spare, no? So I promise that we will try to do that. But definitely, it's very important to support the transport group because we want to make sure that people who move from bubble to bubble are have that bridge, no? That's very important.
Right. Dr. Lim, so now with the Delta variant spreading in the Philippines, what are your thoughts about the inoculation rate here and how protected Filipinos are at the moment?
Well, Janina, one of the strategies that we really want to add to containment, no, of COVID in general and Delta in particular is to make sure that we are able to implement all aspects of our minimum public health standards and take advantage of vaccination as an additional strategy. So, even as we're trying to hit the herd immunity threshold, which is going up because of the transmissibility of this new variant, targeting the most vulnerable sectors of the population, our A2s and A3s, should be able to help us preserve our healthcare system capacity. So, in as much as we want to protect individuals, we have to be very strategic in terms of how we deploy these interventions, no, in the most efficient way manner. So, for example, we only have 10 doses available. Who should be prioritized? Di ba? Syempre, yung mga tao who have the highest risk of potentially getting severe and critical disease, and these have been identified as A2 and A3. So, in the context of Delta, we have to be even more strategic. We don't wait for people in these categories to come to us in the vaccination centers. I think it's very critical for LGUs and their partners to actually seek out our A2s and A3s, make sure they're vaccinated, hit the highest levels possible so that even as we provide them with protection, we're sure we preserve healthcare capacity, then we're sure that we can open the economy safely.
All right, thank you, ma'am. So we have some questions for our audience today. Anna Francisco is asking, the private sector is faced with a very slow arrival of purchased vaccines. Any planned relief to address this, please? I mean, this is for Mr. Concepcion.
Well, you know, it's very hard to get vaccines, actually, to be frank. We ordered the AstraZeneca vaccines on November 27 last year, no? And the first arrivals are only in July. And you can see that this is made out of Thailand. And many countries are after these vaccines as well, no? Same with Pfizer and Moderna. I mean, all vaccines are facing challenges right now, no, because of the demand. So we are doing our best to bring it in. Now, what we have to try to do now is to really plan forward and already calendar that you will really have delays. No? So we have to get the vaccines much sooner, especially once they develop the booster shots. No? Some of these people who have taken the vaccine may need a booster shot sometime middle of next year. No?
Right. Um, so another question from Jeff Aquino is, how about those who have been vaccinated 6 months ago and require a booster shot or revaccination? Will they still be distinguished as fully vaccinated? We can
Can I
ask
take
for,
that
yeah,
question,
go ahead.
Janina?
Yeah,
Yeah. So maybe I just like to clarify that concept. No? There is no recommendation at this point to provide booster doses. And the data that is being shared publicly only has to do with antibody levels being observed to decrease over time. But there's a problem with just focusing on antibody levels. Antibodies only tell part of the story with respect to protection. We get protection from vaccination both from antibodies as well as the component cells of our immune system, which are able to defend us against the virus. And these component cells are not readily measured by commercial laboratories. They have to be done in research settings. So even if you observe your antibodies to be going down, we can count on cellular immunity to back this up and actually even provide more protection to exposures to the virus. Number two, we don't really know what level of antibodies are necessary to provide protection against infection. So even if it's going down, if all you need is 1 unit, then you have more than enough if you have 10, 15, 20 units being measured by your antibody testing. So I guess the bottom line here is that we don't know whether boosters are needed. Antibody levels are not the determinant for providing boosters. There's no recommendation at this point to provide boosters globally. There are only very selected populations for which this is being given. And for the regular individual, this is definitely not recommended at this point.
All right, thank you so much for that explanation. So we have a question from Raquel Reyes. She says, COVID home care, is it helping hospitals which are becoming full, if not already full? Maybe Dr. Gaspar can talk about this?
Yeah. Is it helping the hospitals? Well, I hope we are helping the hospitals. Remember, for the home care program or the home health, it is limited, and it's not the same as the capability of the hospitals. But nonetheless, we are able to take care and provide services for those who are asymptomatic or no symptoms with exposure, or those that have mild to moderate cases of COVID-19. But the key here is that there should be an assessment to determine if what the patient has can be really taken care of by the home care industry.
Right. We have a question for both Mr. Laxon and Dr. Sally. Is the hybrid office setup the next normal, or do you see workers going back to the office 100%? Mr. Laxon?
That will be the new normal. As a matter of fact, even after the herd immunity is achieved, we have already proven that some jobs can be done well at home, and that will be a lot of help for our workers and our companies. And maybe we should get together with Dole to determine the new working arrangement under this work from home.
Yeah.
And but what is worrisome right now is if I go back to the issue of lockdown, if Secretary Concepcion says that it's a very big challenge to get vaccine supply, and we cannot achieve the herd immunity, is there a possibility that uh, lockdown will be imposed again and again and again until we achieve the herd immunity?
Right. Mr. Concepcion, did you want to respond to what Mr. Laxon said?
Sorry, I missed the question.
Yeah. Uh,
Sir?
Can you hear me?
we get that herd immunity, is lockdown still a potential weapon against COVID-19?
Hello? Uh, can you hear me?
Yes, yes, yes.
Okay,
Yes.
no, definitely. Once we hit herd immunity, to me, that's the end of lockdown. I mean, once you achieve 80%, provided that we are able to, practice, learn from what happened in countries that achieved it already and now are facing another wave, is that they became too lax. They removed the mask
Yeah.
and they didn't practice social distancing, and they allowed huge concerts to happen, no? So then that's what happened. So I think learning from that, I think we will be able to prevent lockdowns, definitely, and that's the goal. Achieving herd immunity of 80% or even higher, no, 90%, uh, gives you a thicker defense. The more human beings that are inoculated, 90% of the population, then your wall of defense really becomes thicker. So it will be very hard for, even if the vaccinated get infected, it's still fine because the other person can protect himself, and what the person who got uh, uh, Delta will still be okay. He will. There's a very small chance of him going to the hospital or even dying.
Yeah. Thank you. And if I may add, Secretary, lockdown in the context of NCR, where majority are informal settlers, and they live in a 20, 30 square meter dwellings. In my youth, I used to have a neighbor uh, who houses 5 families in one house, and they schedule the sleeping hours. If we lock down people like this, I think there will be more potential of spreading the virus in those houses. So I'm just talking from my experience.
All right.
And I agree with you that this lockdown should be our last lockdown. And I think it's possible because dati wala naman tayong bakuna eh. Ngayon, we
Yes,
have it.
yes,
Remember in March, we didn't have anything. We didn't have really any weapon. Till about June, it started to come in trickles. But now, when you have 5, 10 million arriving on a monthly basis,
mm,
that's your ammunition. So
yes,
I've seen it. I mean, just recently with Delta, I have friends who got they've taken their vaccine and they got hit, no, and they are good brands, but still
yes,
they don't need to go to the hospital. So you don't need to lock down anymore. People will this will be like a common flu, no, and that's the
yes.
goal. Let's get it to that level, and I believe that we have the chance. If we escape the fourth quarter lockdown free, then tuloy-tuloy na to.
Yeah.
All right.
Thank you. Thank you. I was looking at one day soon. We are going to achieve that herd immunity. And then we can go back to 2 years. We can hug someone, get infected, get a half box of tissue, and then just move on, as you said.
And provided we just don't have huge concerts where everybody is body to body, without mask. Pag ganyan, we will invite trouble, no? I think COVID is here for quite some time, so we cannot go to that usual way of having a sardine bar, no? I mean, that's dangerous. Even if fully vaccinated, being too much many people in one area without mask is very dangerous.
But I
Dr.
heard
G-
that
Janina.
yes,
if I
yes,
say COVID is permanent, and even with all the vaccines, 100% are vaccinated, COVID is still with us, and we have to
That's
live
right.
with it.
I
We
think
have to live
Dr.
Can
with
I
Lim
it.
just
wants
join
to
in?
add
Yeah,
something. Yes.
yeah. I was just thinking about this exchange, and I think what we need to recognize is that all of these levels of protection need to come together and be used efficiently to be able to protect people consistently. So even if the focus right now is on deployment of vaccines because it's the newest piece of defense that we didn't have this before March. Um, the fact that we were able to survive to the extent that we had, just using our minimum public health standards, says a lot about it. No? So, adding vaccination to our bullets, so to speak, is really going to make, I would say, the biggest difference. I think one other thing we need to keep in mind is ventilation is something that might have been left by the wayside, and it's something that we can actually improve. We want to be able to intervene using system controls rather than behavioral interventions. And actually, when we talk about vaccination, that's a system control, just providing everybody with vaccines. You keep that particular, you don't have to think about it. It's something that's already provided for people. In the same way, if we are able to implement capacity controls, ventilation controls in our public spaces, then that will really also make a difference in terms of transmission.
All right. Thank you, ma'am. We have another question for you. Someone is asking, will double masking help prevent transmission?
So this the whole discussion about masks is also something that we need to understand better because learning about the science can help us maximize the protection that we get from masks. So I know when we go around, no, we see a lot of people wearing masks, but they don't wear it properly. They're either utilizing it to cover their chins, not covering their noses. When in fact the whole point of a mask is to cover both your nose and mouth to be able to protect those entry points from being infected by the virus. So you were reminded to use a well-fitting mask. No, that's the first critical piece of information. And then to use a mask that has sufficient numbers of layers. So that's where the concept of double masking is coming from. There are people kasi who opt to use a cloth mask, which is fine if you're not in a healthcare setting, but knowing that Delta is more transmissible and understanding that cloth masks are not woven tightly enough, no, to prevent entry of a virus means that you have to put an extra layer that will prevent these particles from coming in. So I guess, diba, it's very easy naman to imagine. If you hold the cloth mask against the light, you will definitely see, no, the rays passing through. And if rays can pass through, definitely viruses can pass through too. So that's why you want a double layer, not only to provide that particular extra protection, but also to help to keep the mask fit optimal.
All right. Thank you for that explanation, ma'am. We have another question from Tracy Ignacio. Is herd immunity still the viable strategy at this stage? If not, what else?
So I can take that question, and maybe the rest can join. Um, Herd immunity is a moving target. When we started off with the wild type virus or the original Wuhan virus, the numbers that were being targeted were about 70% based on a reproduction number of 2 to 2.5. Now that we have Delta, which is said to be more transmissible with a reproduction number of 5 to 8, the herd immunity threshold has gone up to the mid 80s. So it is a moving target. It's not bad to target it, but we have to recognize that as more and more variants come around, this will definitely impact the herd immunity threshold. That's why we keep saying that the goal, the immediate goal, is actually to identify those who are vulnerable and give protection to these sectors. Because the reason why we need to keep on locking down is to prevent healthcare system being overwhelmed. And if you're able to implement strategies to prevent the healthcare system from being overwhelmed, then the reason for locking down is removed. So, what overwhelms the healthcare system? Higher hospitalization for those at risk. If you target those at risk first, then you don't have as much hospital use, then you don't need to lock down.
All right. Thank you, ma'am. So we have one final question from the audience. So the fourth quarter is usually a relatively strong period in any year for business and the entire economy. So what is your expectation for business activity in the final 3 months this year? And what would be a realistic scenario given what we have seen so far? Mr. Laxon, would you like to comment on that?
Yeah, it was said, Secretary Dominguez said we achieved an 11.8% increase in GDP in the second quarter. But with the continuing specter of lockdown, which we are experiencing right now, the third and the fourth quarter looks gloomier than expected. And even the prophet of boom economist, Benny Villegas, is not very optimistic about our growth if we continue locking down the economy because business is already suffering. And we our momentum is lost every time there's a lockdown. We lose the momentum to go forward. So it is my appeal to our policymakers through Secretary Joey Concepcion. Let's rebalance and refocus our strategy. Maybe, as Dr. Reyes said, vaccine is not the only solution, and lockdown is not the solution, but increasing the healthcare facilities. Maybe we should target that expansion of health facilities so that our hospitals will not be overwhelmed and we don't need to lock down. So,
Right.
thank you.
All right, Mr. Concepcion, you were talking about having the lockdown now so that we can see recovery towards the end of the year. So, what would be your thoughts on the fourth quarter?
Well, if we can lock down the unvaccinated, then we lessen the problem. Actually, if you ask me, 85% of those going to the hospitals are the unvaccinated. But of course, these people have to go to work and earn a living, and and that is the risk area. The vaccinated is a risk, no, but let's weigh down the risk. What is the risk of the vaccinated flooding the hospitals? It's much less than the unvaccinated. So from a business point of view, I will allow the vaccinated to help, be the consumers at this point in time and not the unvaccinated. And that's the strategy we're trying to move. once there's more vaccines, let's only allow the vaccinated to go out and create the spending that we need, no? And leave the unvaccinated uh, just confined to their home and their immediate employer for the time being until they get either the vaccine. Now, if they don't want to get the vaccine because of whatever belief they have, then that's a problem. So to me, their movement should be totally restricted. But eventually, those who really want to take the vaccine will be able to do that in the coming months, and we should not penalize these people. But those who don't want to take the vaccine because they just don't want to, then they suffer the consequence because we cannot be held hostage with the unvaccinated who just don't want to take it for whatever reason. Because what is happening right now is the economy is affecting so many people, so many lives, uh, food, etc. People who are going hungry. We want to avoid that, and the only way to do that is to open the economy. And I agree with Mr. Laxon on that point. But then again, uh, vaccines is just one of the solutions, no? And a very powerful solution. And the other one is to really ensure that what do you call this? We practice the right protocols, no, on social distancing and wearing a face mask. And testing should not stop. No, testing actually from the very start of this pandemic, we've been pushing for testing. Testing creates visibility, so we're able to see have greater visibility. Then we can weed out those that are infected and move them to isolation.
Right. Just to follow up on that, sir, given the situation now, what do you think is the best and worst case scenario for businesses, especially when the holidays come around?
Well, I've seen it, no, in many businesses. After the lockdown, I have a little popcorn store there. We have about 200 outlets. When they open up, sales goes back right away. Similarly, in other businesses, in the restaurants that I've talked to, friends, it bounces back. So business will be able to bounce back because the lockdowns that we have done so far, I mean, this lockdown that we have, I don't feel that it's like ECQ. No, I mean, it's a very relaxed ECQ. You see a lot of people, a lot of movement around. So unlike before last year, I mean, there was nobody in the road. No, but this time, I mean, it's looks like normal. No, so I believe that I'm very bullish that the fourth quarter lockdown free will still be a great quarter for many of those MSMEs to get back what they lost, no? And then bridge them towards 2022. And if we have what we are recommending approved by ITF, then I'm certain that we will not encounter any more lockdowns.
Right. Sorry, we have a few more questions. This is for Dr. Gaspar. From the private health sector's point of view, what are your suggestions to improve the handling of the pandemic?
I think in the private sector, first you have to identify your team, your employees, and see what are the medical conditions that you have. I mean, there's no perfect recipe that if one company does this, that it will work on you. I think it is really, really important that you know your employees, what are the limitations, what are the challenges, and then create a work process or a strategy using the minimum health standard protocol, the additional strategy of vaccination to probably solve and make sure that the employees are very safe.
Right.
Thank you.
Thank you. We also have a follow-up question on the double masking. Do face shields still work, or are they beginning to be obsolete?
With respect to face shields, Janina, I think the perspective that we should take there is that we need to take advantage of every layer of protection we can possibly use. Um, we know that the virus can gain entry through various parts of our face, including our eyes, our nose, our mouth, no? And eye protection is essential in healthcare settings where we manage COVID patients. So the value of using a face shield is to prevent entry through that portal and also to provide an additional layer to a person who's already wearing a face mask, particularly from droplet transmission. So it does have value. And I think in a setting where we keep talking about increased transmissibility, shouldn't we take advantage of every possible layer of protection that we can use?
All right, thank you so much for that. So we are moving on to the closing statements. And as we move on to the closing statement, I do want to ask one more question that I hope you guys can answer as well. So after our conversation about the public health risks and what is needed for businesses to reopen, is there a need to extend ECQ at this point, or what are your recommendations in that regard? So we will get started with Dr. Gaspar. Thank you.
Wow, that's a very tough question. To extend the ECQ, personally, I don't want to have an extension of the ECQ, but it's not the ECQ that solves the COVID-19. As what my colleagues have mentioned earlier, it's just additional layer. Now we have to have the commitment of everyone, including the common tao, to make sure that they practice the social distancing. But as everyone would travel along EDSA, you would see a lot of people lining up in transportation. Do you observe social distancing? Probably not. So there's a lot more to discuss, more than the ECQ, but probably more of measures that the government and the private sector could collaborate to make sure that the people that they have would be practicing that and would probably understand the true value of making sure that we are participating in those standard protocols. Thank you.
All right, thank you so much for that. Dr. Anna, what would be your closing statement?
So if we're talking about the ECQ, I think from a purely health standpoint and from the lens of an infectious disease specialist, of course, one of the main answers for addressing any outbreak is really a mobility restriction. And this can be helpful in making sure that transmission can be controlled. But as we've all observed, the ECQ that has been implemented this time around is really not the ECQ that we observed mid last year, no? During the really bad surge that we have in July and August, and which really was very effective in keeping the numbers down within maybe a 3 week period. No? So currently, what we're seeing is some mobility restriction. We're not seeing the numbers going down. And much as we would like to keep an ECQ still, we need to figure out why it is that we're not seeing the restrictions, the mobility restrictions that we need to see to address the problem. So maybe, no, the ECQ as we imagine it to be will not be the answer. Maybe we need to re-strategize, think about what will keep movements down and focus on those because that's really what we're after when we're talking about the containment strategy.
Thank you so much, ma'am. Mr. Laksa?
Yes, the first two lockdowns, more than 100,000 MSME companies permanently closed down. Now, this 2 week lockdown, we are not sure yet how many more companies will be fully shuttered. But if we keep on postponing the inevitability of opening the economy because of the variant spread, then there might not be too many companies to save at all. And it is our earnest appeal to our policymakers, through, of course, our champion in the business sector, Secretary Joey Concepcion, to refocus and rebalance the COVID response to protect not only the life of people, but also the nation's economic life. Agreeably, we are at war against COVID-19, but unlike in a conventional armed warfare, we cannot we can defeat this unseen powerful enemy not by lockdown, but through mass vaccination, masking, and other health protocols. But and please give our economy a chance to rebuild, recharge by avoiding lockdown as the quickie and reckless solution. It is a very bad solution. Thank you.
Thank you so much for that, sir. And finally, Mr. Concepcion.
Well, I mean, in a couple of days, the IATF will make the decision And it will really boil down to what the numbers look like. Well, if I were to look at what Okta is saying, they are more positive for NCR, no? But then again, let's wait as it comes out. But I really look more at the immediate action that we really need to do, no? It's very important that every citizen out there who has not taken the vaccine should take the vaccine if medically you are allowed or if you are age, no? And that is a civic duty, no? This is not just a war. This is a war that beyond our imagination. We never thought that we would get to this point whereby not only the lives that are being affected, but even the entire livelihoods of many of our MSMEs, no, who are struggling at this point in time. And I understand the pressure of avoiding lockdowns. So the way forward is, as we suggested, is let us plan out our game plan. We have to be smarter than COVID-19, especially Delta. Let us not expose the unvaccinated to out there in the open and they will be like sitting ducks now. So let us allow the vaccinated the greater mobility as we open up to be able to spend money because they cannot spend while being at home. They can only spend when they go out. So let them go out to the restaurants, to shop, and all of that, but under a scenario where everybody is fully vaccinated. And so that is our model. No? The unvaccinated who are not vaccinated, then they should get the vaccine and be able to join the vaccinated going out. So that is a plan that we have in place. And of course, I fully support our mayors. No? They are the key really now in this battle. They are the generals in this battle. NCR must win. And the only way NCR can win against COVID-19 is if we are able to achieve at least 80% under Delta herd immunity.
All right. Thank you so much for that, sir. That concludes our program for today. Many thanks to our speakers for sharing your insights, Mr. Concepcion, Mr. Lacson, Dr. Lim, and Dr. Gaspar. Much gratitude also to Aventus Medical Care Inc. for making this session possible, and to our partner organizations, the British Chamber of Commerce of the Philippines, the Bank Marketing Association of the Philippines, the Management Association of the Philippines, the Philippine Chamber of Commerce and Industry, and to our media partner, the Philippine Star. And of course, to everyone who joined us today. Be sure to tune in to Business World social media pages to be updated on our next project. Again, this is Janina Ibanez, and this has been Business World Insights. Good afternoon, everyone.